Hi, Dr. Peter Montgomery, family practice doctor, here to share with you the 5 W's to stop the coronavirus that we are all washing, waving, wiping, and whoa, don't touch this. Ways we can stop spreading the coronavirus. We're social distancing and now we're in lockdown. Whereas this is day 3 of national lockdown. It is Wednesday, March 18th. Big news, Ford, General Motors, Chrysler, Fiat all closed their factories until March 30th. And so everybody's doing a lot of what they can do. My healthcare system, I work with SSM Healthcare System in St. Louis, and we are opening up drive-through testing. And I'm going to show you a drive-through testing site and have you talk with the nurses who are on the front line. But I'll take you right there in a second. Hi there. Dr. Peter Montgomery doing the COVID lockdown update day 3. Our hospital has set up a drive-through station here, and I've been talking with the staff, got their permission to talk to them, and they have seen several patients today, and here we are. Everybody's working here.
Hi there.
And doing the best they can. Thank you for all your work, and thank you for stepping literally in the front line.
Correct.
You know, you're gowned up, you got protective equipment, you're protecting yourself. What are your thoughts and what are your thoughts about this so far?
Well, this is a great place to be tested because you're not going to be around a lot of public. You can come in, you drive through, you sit in your car. SSM is really on top of this.
I'm really proud of SSM.
I am too.
The leadership has done a great job, and everybody stepped up. You know, we had doctors who were volunteering to work the phone lines when they're sick.
Wow.
You know, because so I'm really glad everybody's stepping up. What are the things that you've been happiest about this? Working the best.
I thought it was great. The people that came up that had appointments actually had masks on.
Yes.
Nice.
Some of them had gloves on.
Mm-hmm.
And they knew about the social isolating themselves.
Mm-hmm.
And they just knew that we're going to treat their symptoms.
Right.
And basically, you stay at home. You know, everybody's going to.
And then, of course, they're aware now if they're positive to be more aggressive when they start getting shortness of breath. Because the problem is when the people develop the lung fluid problem, that's the big problem is then the fluid buildup in the lung. At least they know to be a lot more alert, and hopefully that'll help keep paranoia down if they're negative, that they don't have to be too
They've been very patient too.
They've been very patient.
Excellent.
Yes.
So fantastic.
So we've done a lot of
They're
teaching. A lot of
understanding the
teaching
process.
today.
All
So
right.
we're just glad to be here.
And we got the supplies.
Wash
We'll
your
work on
hands.
it. Wash your hands and wave.
And wave.
Wipe down surfaces.
Wipe down.
And whoa, don't touch this.
Don't touch this.
Don't touch this.
this.
All right, and the goggles and masks help us not to do it, and people can do that at home just to learn to have it. I'm just walking around with my hands in my pockets.
Right.
You know, and so I think that's been helping a lot of people. So,
Absolutely.
Well, thank you so much.
You're welcome.
And thank you and hopefully we'll have even more stations. I heard we're going to have 5.
I know that they have plans to open 2 more this weekend.
Mm-hmm.
I believe one is going to be at the health center. I'm not sure where the third one's going to be. And then just depending on what the need is, we'll go from there.
All right. Well, thank you very much. This is
You're
Dr.
welcome.
Peter Montgomery, family practice doctor.
Awesome.
And-
Joanne Thone, registered nurse.
Delana Mason.
All
Thank
right.
you.
Frontline troops, you guys are doing great.
Thank you.
Thank you.
Rocking it. Have
All
a
right.
good day.
All right. For me, that was very exciting to see the frontline nurses doing their great job. We are referring patients to a website where they take a series of questions. If they meet criteria, they'll be given an appointment to come in for testing. That it seems to be working very well. I've sent 3 of my patients there in the last day. So I'm good to see that, actually see where they're going and what's happening with that. Healthcare systems around the country are doing this, around the world are doing this. Increased testing, we'll know who has it and who doesn't. We'll have a better idea how to catch patients early before they start developing the respiratory distress syndrome that is actually killing the people. That their lungs are filling with fluid. We want to catch it before that. We're developing new therapies, ways to interfere with all that inflammatory reaction. We're getting better at that. So things are improving. So I'm just going to keep everybody updated with what we're doing. And thank you very much, and I'll be back tomorrow.